Hi, I'm Kayla. I am a biblical naturopathic doctor with Sozo Holistic Healing, where families can be saved, healed, and made whole. And normally I have my husband Christian with me on these videos to make things more interesting, but he's got somewhere else that he needs to be at the moment, so it's just going to be us this time. And on this channel we talk about our just family's lifestyle of being like natural, holistic, crunchy Christian, definitely focusing on the natural, but especially focusing on Jesus. And we are, as I'm filming this, we are about to have baby number 2, so we've also been talking about pregnancy and kind of those sorts of things as well. And I am saying currently as we're filming this because it is February as I'm filming this, but I'm anticipating posting this in April. Just trying to get ahead of myself because I don't think I'm really gonna have time for filming videos with a newborn to deal with. So before I forget, before I get started with today's video, I just wanted to remind you if you could please like and subscribe this video if it is something that you're feeling, just so that we know that like, hey, this is something that is worth continuing, that is something that you're interested in, so we can keep bringing more education and more good vibes and good things out there and not just shouting into the YouTube void and nobody's interested. So we'd appreciate just getting that feedback. And if you caught my last video, I'm actually shooting these 2 videos back to back. I'm wearing the same clothes, it's the same night. Just trying to get ahead of myself. And last video I talked about a new offering that I started this year as part of my practice called Craniosacral Fascial Therapy, working specifically with babies. And so if you want to check that out first, I explain what is craniosacral fascial therapy, what is fascia, what does all of that mean, how does it apply to babies, what kinds of issues does it help babies with. But for this video, I wanted to go a little more in depth on really why I truly believe every baby should have at least one session of craniosacral fascial therapy, or CFT as I'm going to refer to it through the whole video because it's a bit of a mouthful. Because here's the thing, and it's something that in this year I've been noticing, that most of the parents that have been coming to me or really expressed any kind of interest in CFT have been the ones that like have babies with really serious issues, which I understand, of course, like they actually have that urgency and they really want to get help for their children, and I appreciate their business and working with them, and it's been really great. But I've noticed that there are so many parents out there that really I hear them talking about issues that they've had with their kids. I hear their struggles and things like that, and they're just not booking a session with me. And it's not that I'm like so desperate for business or something. It's really just what I want to highlight is that really every baby, whether you come to me or not, every baby needs CFT, and it is so valuable, and it helps with so many different issues that newborns especially, but just babies struggle with. And not addressing these issues as a baby can really lead to issues further down the line in their life that as a parent, I'm sure every parent would love to spare their child from those things with just a few simple sessions. So I won't repeat myself into what is craniosacral fascial therapy and fascia and all that stuff, but I will just repeat again from the last video that I did what issues most commonly CFT helps with in infants. And probably the most common one that I see is anything to do with like feeding issues, mostly because like breastfeeding is challenging and a lot of new moms have a really hard time, and part of it is just learning about like the latch and the flow and the milk supply and all those different things. But a lot of it is actually just the fascia as the baby gets born and going through the birth canal. The fascia gets strained and gets twisted, and that can really affect baby's ability to latch on properly, baby's ability to suck and swallow properly. Sometimes it's just like they really can't pull the milk out themselves because the fascia is so tight. It's just the milk is just like squirting into their mouth and that's all they get. and so they're still hungry again like an hour later because they're not getting adequate supply, and mom is just like stressed out because her, it's just painful, and to be feeding round the clock, going through constant pain, like I've been there and I experienced it myself, and it was so challenging and frustrating and heartbreaking to want to be feeding your baby and to be in so much pain and to have that conflicting emotions. And so I get it, and that's probably the biggest reason why I'm so passionate about CFT, because like I have been there, and I wish I had CFT at the time with my first baby, and I think it would have made a huge difference, because she did have a lip tie, and lip ties and tongue ties are also a contributor to some of those issues. But sometimes even getting the revision done really causes the fascia to lock up even more, and some people even experience more pain after having the revision done, or it just doesn't really, like in my case, it helps a little bit, but it just doesn't help with the pain. And so there's so many, basically all the feeding issues, like lip and tongue tie issues, difficulty sucking and swallowing, constant nursing, painful latch. Even as babies get older and they start eating solid foods, there are some babies that they just gag on food all the time. They have a really hard time swallowing their food. The other biggest issue that I see is any kind of digestive issues that can lead to colic and constipation and reflux. I know is a really big one with babies. Some of these things can be like food sensitivities and stuff like that too, but if the fascia is locked up and it's affecting all of those internal organs, then baby's not digesting well, can lead to a lot of painful gas and indigestion and just things not moving around very well. And that can lead to a lot of stress for parents if baby is constantly crying, constantly needing to be held, not sleeping very well, all of these different things that I feel like if it's either it's feeding or it's digesting or it's sleeping, every parent has a hard time with at least one of these in the first month or two of having a newborn. And so I feel like it's so important for every single baby, just because I don't think I've ever heard of a single baby sleeping through the night and feeding perfectly fine and not having any digestion gas issues. It's just, I've never seen it before. And I see how hard parents are working, and I see how they're struggling and they're stressed out, and every parent deserves to have a break, and every baby deserves to have a break because they're the ones going through it too. Another really common group, I guess, of issues you could say are symmetry issues. So this could be a lot of times head shape. Baby gets a flat head on one side, especially if they have torticollis, and they, their shoulder or their neck can't move very well, or even head shape that's getting pulled in a weird direction, or a recessed chin that's getting pulled back, or if you see a baby just lying down flat on their back, babies are supposed to be kind of curled in like this and be totally symmetrical, but if a baby's kind of lying wonky ways or has their arm out like this or something like that actually it seems totally fine, oh, that's just the way that they're lying, but it actually shows a symmetry issue. And this is of course partly cosmetic, because your face is really pliable as a baby and everything is still getting fused, but once things are fused together, if you have a recessed chin, that's your chin for the rest of your life. Or if your head is flat on one side, if you don't get a helmet or something, that's the shape of your head for the rest of your life. And symmetry issues can also contribute to developmental delays, because if baby's kind of wonky side, or if their body's pulling them in one direction, they may have a harder time rolling, a harder time sitting up, and this can lead to delayed walking. They might even have speech delays too, because if their fascia is tight in their head and they're not getting enough blood flow to their brain, then it can affect their cognition, their learning, their ability to speak, or even if their tongue and their jaw and all of this stuff is locked up, they might have a harder time forming letters and making words. They might have more crooked teeth, all these different things. So it's partly cosmetic, but it's also partly developmental, and can really set babies back several months in their development if their fascia is not at its best. There's also other like random issues that babies commonly experience, like earaches, TMJ, autism, eczema. Like lots of babies nowadays are getting a lot more eczema. Autism rates are going up higher. It's also really common for babies to, at some point, have some kind of medical intervention, whether that is like circumcision for boys, oral tie revisions, like if they have a tongue or a lip tie or something like that, even vaccinations. All of these things they're medical procedures. We won't discuss the controversy of any of those right now, but just objectively, they are medical procedures and they do have a kind of an outside effect on the body and to some degree pain on the body, and so the body experiences those procedures as a form of trauma, and that can cause the fascia to lock up and contribute to a lot of these health issues that I've just talked about. And so if your baby has any medical procedures, if they get circumcised, vaccinated, have any kind of oral tie revisions, or even if they in the hospital they were in the NICU, they were separated from mom, they were needed like heart surgery or some medical procedure in the hospital, that can cause their fascia to lock up and can create a lot of these health issues later on. So getting the fascia unwound is really important after these interventions, just to make sure that you're setting your baby up for a faster recovery and for avoiding as much as possible any of these other issues that I've just talked about. So like I said, I feel like every baby really falls into the category of these things at one point or another. And so maybe at this point you're going, okay, great. Like, yes, I would love to take my baby to a session. I really think that this is valuable. Ideally, a baby should get a session maybe like in their first week of life, maybe their first month. I know sometimes it's harder to get out of the house. Personally, I do home visits just to make things easier on new parents. But after, any kind of procedures or things like that too, if you want to do follow-up sessions just to clear everything up after that as well. But maybe you're still listening to this and thinking, well, I feel like my baby's fine. Like we had maybe a little bit of digestive issues or a little bit of sleep issues, but it really wasn't that bad. It's not really worth booking a session, and I get it. Maybe at this point with your newborn, maybe you're just not convinced and it doesn't seem valuable to you. So let me just share what happens, how fascia issues present in older children, because fascia does not unwind by itself. It's not something like you may have breastfeeding issues or like painful breastfeeding for the first like month, and then everything gets better because like your body toughens up and baby's mouth, it gets bigger, and so things get easier, and maybe you think, oh yeah, that's perfectly fine. Like we had that issue before and now it's not a problem. And maybe the issue isn't a problem, but the fascia doesn't unwind by itself. It needs to be unwound at some point. And so even though that particular issue is gone, it might present itself as something else later on in your child's life. And just personally, like working on a newborn is so much easier than working on a child, like a toddler that does not want to sit still and does not want to be touched, or even an older child that is just like, I don't want to lie on this table for an hour and have this stranger touch me. Like newborns are just so simple. They just lie there and let you move them around and everything gets unwound much easier. So if you can get it out of the way while they're a newborn, it is so much better, because as children, if the fascia does not get unwound, it might present itself as asthma or more frequent infections like ear infections, sinus infections. It might contribute to ADD and autism and learning disabilities. It might even show up in pain like neck pain, migraines, headaches, scoliosis, other kinds of like symmetry issues, even bedwetting and potty training issues. A lot of these things, if you're wondering what does that have to do with fascia, a lot of it has to do with just like a lack of blood flow, lack of stimulation to the brain, lack of nerve impulses traveling traveling productively, I guess you could say, or efficiently, because when the fascia is locked up, everything just like doesn't flow as well. So getting the fascia unwound makes your child just more opened up in their airways and in their brain and in their ability to move. And if you as an adult or other people that you know have certain issues that may seem like normal for an adult, normal because most of us don't get our fascia unwound. I mean, I didn't as a child because my parents didn't know that it existed. I didn't know that it existed until somewhat recently. So a lot of adults have underlying fascia issues that have just never been addressed. And a lot of this can be like migraines and headaches. Again, going back to that lack of blood flow. It can be a lot of different pain in different areas. So like neck pain, back pain, hip pain, jaw pain, TMJ, pelvic pain, sinus congestions. I know like ear infections are not as common for adults, but it can happen. Getting CFT is also helpful as an adult, even if you didn't have any of these issues before. Like as an adult, you may be more likely to get in a car accident or to have some kind of surgery or some kind of medical procedure. Like I mentioned with babies, you know, they have their more common medical procedures, but with adults, it might be like dental work or getting a C-section if you're pregnant, or like hip surgery, knee surgery, all these things that the body is again gonna recognize as trauma and cause the fascia to lock up and create more pain and more issues and more headaches and all those just blood flow and body movement instability and locking up and things. So even as adults, CFT is quite helpful. I personally don't work on adults, but there are people that do if you can search in your area. So all of this to say that every baby, every person has fascia issues, and these things need to be addressed. And like, I mean, I don't know about you, I didn't even know what fascia was for the majority of my life. I took 3 biology classes and 2 anatomy classes and somehow never learned about fascia. And so it's something that just does not have enough awareness out there and does not have enough people recognizing a need for it. I think this is kind of like chiropractic care, maybe like, I don't know, 30, 40 years ago at least, you know, when everybody thought that like chiropractors are quacks and things like that. And nowadays, like, people are getting a lot more awareness into chiropractic care and really the effectiveness of it and the safety of it and the value in it. And so CFT, I think, is just, it's so small and under-recognized so far. And so I would love to just kind of get the word out, get more people recognizing something that really needs to be addressed, not just in babies, but in everybody, everywhere. So if you do have a baby, and if you are local to me in the San Gabriel Valley in California, I'd love to work with you. If not, of course, I sincerely hope that you have somebody in your area that you can look for. If you need any more information, again, you can go watch my video right before this, but you can also go check out my blog post that I posted for this month of April on my website, sozoholistic.com/blog. The post is titled Craniosacral Fascial Therapy for Babies, Everything That You Need to Know. So there's a lot more extra information on what CFT is, what a session looks like, how you can find somebody in your area if you don't live locally to me. And of course, you can always contact me too. I will put my contact information below so that if you have any other questions, whether you want to be a client of mine or not, I'm happy to work with you or to just point you in the right direction if I can, so that you and your baby can get the help that you need. And please don't forget to like and subscribe before you go if this video was helpful for you. And please do me the biggest favor of spreading the word, even if you don't have a baby yourself yet. If you happen to overhear a mom talking about having a hard time breastfeeding or talking about her baby struggling with colic, please share this information with her too, so that she can get the help that she needs for her baby, whether it's through me or not. I really don't care. I just want as many people as I can to know about this so that they can get the help that they need for their babies. I will see you next time. Thank you very much for watching. Bye.